Cognitive behavioral therapy for depression, for example, is by now widely accepted. One of the reasons I think why it's accepted is that it falls into the psychotherapy model. So people have been used to psychotherapy for a very long time. I think when Freud innovated the talking cure, it was quite controversial. And I must say, when I was studying initially to become a psychiatrist, and this was way back in the early 70s, the idea was that if you were depressed, there had to be some reason harking back to your past, and this reason had to be ferreted out and rooted out. And it was Albert Ellis who actually suggested that maybe changing your thinking could make a difference. And the general idea was, don't be ridiculous. If changing your thinking could make a difference, we would have already made that difference. But what he said is you have to do it in a systematic way. And it was really many years until Aaron Beck came up with the idea that the thinking had to be changed in certain ways, and that this could be categorized in certain different types or bins. You could have fortune telling, you could have black or white thinking, you could have these various categories. And it was the systematic way of helping people lump the distorted thinking of depression that helped make it accepted. But initially, it was quite outrageous, the idea that you could just change your thinking, because the idea at that point, by now the talking cure had become accepted, and at that point it was you had to find out what your mother had done wrong to you in order to figure out why you were depressed, and then once you figured that out, that would help. So there was initially the same kind of resistance as there is whenever you have a shift in a model. And that's what has happened, and to some extent still happens in the case of light therapy for seasonal affective disorder.